In this session, we are going to describe the anatomy of the facial nerve, its deep origin, function, superficial origin, and relations, course and relations, the distribution of the facial nerve, and the effect of its injury. So, that is the facial nerve, which we are going to start its anatomy. The nerve itself will start with the function and its deep origin. The functions are special visceral efferent motor fibers which arise from the motor nucleus of the facial nerve, general visceral efferent fibers or parasympathetic from superior salivatory or salivary nucleus, special visceral efferent fibers, sensory fibers from the taste of the anterior third of the tongue, and general visceral efferent from the organs supplied by this nerve. What we can see here is the abducent nucleus, where the facial nerve fibers are curving around the nucleus itself to form what we call it facial colliculus in the floor of the first ventricle. So this is the abducent nucleus, but these two are the facial nerve nuclei, and this is the intrasubstance course of the facial nerve, where the fibers will curve around the abduced nerve before it comes outside. The superficial origin of both the facial and the vestibulocochlear nerves here, as shown in this specimen, from the pontomedullary angle above the inferior cerebellar peduncle. That is the inferior cerebellar peduncle, and that is the pontomedullary angle. So the nerve arises together with the eighth nerve from that pontomedullary angle above the inferior cerebellar peduncle. That is the superficial origin. The functions, as we said, are four functions: special visceral efferent, general visceral efferent, special visceral efferent, and general visceral efferent. There is some communication for general somatic efferent fibers between the facial nerve and the trigeminal. The deep origin from nuclei, the nucleus solitarius, which receives the special visceral efferent and general visceral efferent fibers. The motor nucleus of the facial nerve, the motor nucleus for the structure supplied by the facial nerve, and superior salivatory nucleus, which is a parasympathetic ganglia to all the glands of the head and neck except the parotid. The internal course, as we said, the motor fibers pass dorsally and medially, forming a loop around the abducent nucleus, forming what we call it the facial colliculus. The superficial origin, as we said, at the pontomedullary angle above the inferior cerebellar peduncle. Here is the internal auditory meatus, which is the foramen through which the facial nerve will leave the cranial cavity. As you can see here, this is a transverse crest which divides the internal meatus into an upper and lower parts. The facial nerve will pass through the upper part, that is the start of the facial canal. The course and relations of the facial nerve will start by the intra-Bitras course. The intra-Bitras course, that is a section in the timbral bone showing the facial canal, showing the middle ear cavity and the branches within the Bitras part of the timbral bone. So the nerve will pass laterally with the vestibulocochlear, as we said. In the upper area, the vestibulocochlear will be in both of them, and to the internal auditory meatus, which will be beginning over here. Then it will pass at the bottom of the meatus. The nerve will pass laterally above the vestibule of the inner ear to reach the medial wall of the middle ear. So it comes from the internal meatus, pass laterally here above the vestibule until it curves sharply backwards, forming the genu, that is the geniculate ganglia here, and now it passes above the medial wall of the middle ear, that is the part above the inner ear, and then it bends sharply, as we said, backwards above the middle ear medial wall and forming the geniculate ganglion. Then it passes behind the posterior wall of the middle ear, passes downwards behind the posterior wall of the middle ear to come out through the Thyromastoid Foramen, that is the part behind the posterior wall, and that is the Thyromastoid Foramen. So that is the course of the nerve within the vitreous part of the timbral bone. First, laterally above the vestibule of the inner ear, reaching the medial wall of the middle ear, it will sharp backwards, forming the genu, then above the medial wall, and then behind the posterior wall to come out through the Thyromastoid Foramen. That is a section in a real timbral bone showing the facial canal in blue. That is the promontory of the which form the main part of the medial wall of the middle ear, and these are the two foramina in the medial wall, the rounded and the oval windows. This is the mastoid with the mastoid air cells, and this is the mastoid process here. That is the carotid canal, which form part of the anterior wall of the middle ear. The extracranial course, it will emerge from the Thyromastoid Foramen to run forwards in the substance of the parotid gland, that is the parotid gland, which have been reflected upward to show the nerve itself with its branches. So it will become, or it will enter the substance of that gland, being the most superficial structure to the vein and the artery, the external carotid, and the retromandibular vein. So that is the nerve as it comes out from the Thyromastoid Foramen to enter the substance of the gland. Then it crosses the styloid process, which is over here. The retromandibular vein, that is the retromandibular vein, and it will cross the external carotid, which is not shown over here. So the arrangement structure from superficial to medial, the nerve, the vein, and then the artery. It divides behind the neck of the mandible into its 10 branches, which will come out from the anteromedial surface of the parotid gland. This is the branches which comes out from the anteromedial surface of the parotid gland. It will give some branches behind the auricle, but these are the branches in front of the auricle, the 5 branches which you will see them. Now, the branches within the facial canal, it will give the nerve stapedius muscle, which supplies the stapedius present in the pyramidal process. Which that nerve will supply the stapedius muscle, which is attached to the stapedius bone. Then the greater petrosal nerve, which comes from the geniculate ganglion. And this nerve arises from the ganglion, it is a parasympathetic fibers and test fibers. The parasympathetic go to the trigopalatine ganglia, the test fibers which come from the mucous membrane of the palate and the epiglottis, that is the greater petrosal nerve. It reaches the cranial cavity, that greater petrosal nerve, through a hiatus in the anterior surface of the vitreous part of timbral bone, then leave the cranial cavity through the to the foramen lacerum, where it joins the deep petrosal, which is a sympathetic nerve coming from the sympathetic plexus around the internal carotid. Both of them will form what we call it the nerve to pterygoid canal. This nerve to pterygoid canal will pass through that canal to reach the trigopalatine fossa, where it will end in the trigopalatine ganglia, and its branches will come with the branch of the maxillary nerve to supply all the glands of this area, the lacrimal, the nasal, the palatine, the pharyngeal, and taste fibers, as you said, from the palate and the epiglottis. The third nerve in the vitreous part of the timbral bone within the facial canal is the chorda tympani, the largest branch here, which arises from the facial nerve at about 6 millimeters above the Thyromastoid Foramen. That is the Thyromastoid Foramen here. That bristle here represent the facial nerve as it comes out from the facial canal out through the Thyromastoid Foramen. The chorda tympani will arise 6 millimeters above that foramen, where it will go through the posterior canaliculus of the chorda tympani among the posterior wall of the middle ear. Then it will pass forward on the medial surface of the tympanic membrane here, between the fibrous and the mucous layers, crossing the handle of the malleus, as you can see here. That is the handle of the malleus. Then it comes out from the tympanic cavity through the anterior canaliculus of the chorda tympani, leaving the cavity through the vitro-tympanic fissure to the infratimbral fossa, where it will join the lingual nerve. That is the course of the chorda tympani within the tympanic cavity or the middle ear cavity, as it goes very close to the tympanic membrane between its facial or fibrous layer and the mucous membrane to the cross the handle of the malleus from what we call it the posterior canaliculus and the anterior canaliculus. The posterior canaliculus actually between the angle between the lateral wall and the posterior wall, and the anterior canaliculus will be in the anterior wall of the middle ear cavity to come out through the vitro-tympanic fissure to the infratimbral fossa to join the lingual nerve. Through the lingual nerve, it will supply both the submandibular and sublingual salivary glands and carry the taste fibers from the anterior two-thirds of the tongue. That is the chorda tympani. The branches which come out from the facial nerve as it come out from the stylomastoid foramen are the posterior auricular nerve, and this supply the auricularis posterior and the occipital belly of the occipitofrontalis muscle, and branch which we call it the gastric branch to the posterior belly of the gastric. That is the posterior belly of the gastric over here. And styloid branch to the stylomastoid, which is this one. This is the stylomastoid, which is very closely related to the posterior of the gastric. That is the common tendon of the gastric, that is the anterior belly of the digastric muscle. Then to the face, the 5 terminal branches of the facial nerve are the temporal, the zygomatic, the buccal, the mandibular, and the cervical branches. And those branches supply all the muscles of the face and the scalp, including the platysma muscle in the neck. That is the branches of the facial nerve. This is a summary for the branches of the facial nerve. That summary shows the interacoustic meatus here, where the nerve will be entering its upper part, then reach the geniculate ganglia, where it turns backwards, as we said, to form that ganglion. Out of the nerve of the ganglia will come the great petrosal nerve, which will unite with the deep petrosal nerve, the sympathetic nerve, to form the nerve to pterygoid canal. That is the nerve pterygoid canal here, which will lay in the sphenopalatine ganglia. That is the sphenopalatine ganglia over here. Then it will end by supplying the lacrimal, the nasal, the palatine, and the pharyngeal glands together with the taste fibers to form the palate and the epiglottis. That's the nerve stapedius, which supply the stapedius muscle within the middle ear cavity. That is the chorda tympani, which, as we said, will be on the surface of the tympanic membrane, come out through the bitrotympanic fissure in the infratympanoid fossa to join the lingual nerve, where it go to supply the submandibular ganglion, and end by supplying the submandibular gland and the sublingual gland, and give lingual taste fibers, carrying taste fibers from the anterior two-thirds of the tongue. That is the Thyromastoid Foramen, where the facial nerve will leave the facial canal. After it leaves the facial canal, it contains only special visceral efferent fibers, motor fibers to the muscles of the face and the scalp, and have no parasympathetic or taste fibers or other of its 4 functions. It's only one function when it comes out. That is the auricularis superior, and that is the auricularis inferior, and that is the occipitalis, which is supplied by the posterior auricular nerve, and that is the parotid gland, where the nerve is going to pierce or lie in the substance of the gland. That is the nerve to the posterior of the gastric, and the nerve to the thyroid, and that is the timbral branch, that is the zygomatic, the buccal, the mandibular or marginal mandibular, and lastly the cervical branch. That's a summary of all branches of the facial nerve. Now, to describe the facial nerve paralysis, we have that slide on the right side for a patient having left facial nerve paralysis. As you can see in that one, the healthy side on the right side pull the mouse to each side by the healthy vaccinator, which will pull the mouse orifice to the right side. Also, you can see the right eye, he can close his eye using the orbicularis oculi, which is still healthy. On the left side, the eye is not opened. So these are the main features when you look to the face of a patient with a left nerve paralysis. Other features will be also there: loss of sensation, taste sensation on the anterior two-thirds of the tongue, dribbling of saliva from the unhealthy side, and the patient cannot blow his mouth, cannot whistle, and so on. These are the features of that left side. On the other side here, you can see a lady with a right nerve paralysis. The right eye now cannot be opened. The mouth is pulled toward the left side by the healthy vaccinator on the left side. That's again the main features for a paralysis of both facial nerves, the left and the right one. Now we have to differentiate between the 2 types of the facial nerve paralysis. There is what we call it the upper motor neuron lesion and the lower motor neuron lesion. When you see from that diagram here, there is a crossing from one side to another in the brain level or at the brain level. So that crossing will not affect the upper half of the face when the lesion is at the brain level or at upper motor neuron lesion. You can see in that diagram here the face on the right side, the upper half is safe while the lower half is affected. When the damage is below the level of the brain or at the nerve itself outside as it leaves the substance of the brain, that's what we call it the lower motor neuron. Both sides of the upper and the lower parts of the face will be affected. So when you are examining the patient, in the lower motor neuron, you can examine the eye to open or to ask the patient to close. He cannot, but he can do that in case of upper motor neuron lesion. So in the upper motor neuron lesion, the muscles around the eye are not affected as they receive supply from both sides of the brain to the face. That's all what we have about the nerve, about the facial nerve itself, the normal pathway and normal course and distribution and the effect of injury of such nerve.